It's because the blood vessels are being inflamed by something. So now we have something irritating the blood vessels, and the body decides to excrete it out through the kidneys. So now the kidneys are having to process this irritant. Hi, it's Dr. Casoni. Today we're going to talk about urinary tract infections and yeast infections vaginally. It's a great topic. Let's get started. Okay, so urinary tract infections are really coming from the top down. Now, I know that when you go to a conventional care doctor, they don't look at any causative factor. They're not thinking through the physiology. You're just going to get rounds of antibiotics, which can be important for arresting the infection if there is one. However, they're not going to take care of the cause, and oftentimes they can even make it worse. And then we have greater recurrence, and it's just a disaster. And then you end up in my office. So I'm going to educate you about this. So the top down refers to the kidneys at the top of the urogenital system. And then from the kidneys, there is a P tube called the ureter. And that is all coated with a protective layer, right? Because there's always going to be the possibility of harmful agents being excreted. So there's protection there. It's going to go down to the bladder and then out the pee hole, which is called the urethra. So that's from the top down. So this would be the person who is actually excreting something out through the kidneys that is more agitating than normal. And when that happens, typically it's because the blood vessels are being inflamed by something. So now we have something irritating the blood vessels, and the body decides to excrete it out through the kidneys. So now the kidneys are having to process this irritant, and then now the irritant is going to go down through the P tube, the ureter, to the bladder. And so slowly over time, the whole system is less protected. It's inflamed. Still no infection. But at that point, it can spill over to an infection at any time. And the symptoms are going to start with something more like burning pee. It's happening at the urethra, not really vaginally. And this one is not really generally affected by intercourse. The other one is, and we're going to discuss that and why that's the case. But keep in mind that the person is exposed to or consuming something that's irritating their blood vessels, and the body is flushing it out through the kidneys. So there also might be, prior to the infection, increased urination and even increased thirst because there's a greater output than normal. If it's bad enough, then that person will start waking up at night. Generally, they're thinking, oh, I'm drinking a lot of water. But that's not really what's happening. Sleep is a priority. However, at this point, the priority is shifted to flushing out the irritant. And so they're woken up in the middle of the night to urinate. Especially would be advanced if it's urinating at night more than one time. And then even also more advanced would be if that person starts to experience cramping in their calf muscles or feet, because what's happening at that point is the body is pulling fluid from the rest of the tissue to do the flush. And so there's dehydration. That's what causes the cramp. Dehydration plus an imbalancing of the electrolytes. So if the person took magnesium and potassium and calcium and electrolytes, they would offset the cramp, but they're not taking care of the cause, which is the body's got irritated vessels and it's flushing some waste out through the kidneys. Now, the most common irritant is by far carbohydrates that have turned into sugar. Many people can handle high amounts of carbohydrates and they are just fine. That's great. But if those sugars stay too long in the blood vessels, they will inflame the blood vessels, and the body is either going to start putting it into fat cells really rapidly, so that's the person gaining weight, and or might start peeing out the sugars. This is called glucose urea, sugar in the pee. Or if it's not even in the urinalysis, if you check it and there's no sugar, it's that it's triggering that flushing, and sugar will be sure to come at some point. Remember, urinalysis is just a window. It's just one sample. It doesn't represent the whole month. So, but nonetheless, in the old days, funny enough, they would call it ant urine because somebody would pee on the ground and the ants would go to the urine because it has sugar in it, glucose urea. Now, more recently, the exposure to spike protein has caused irritation to the blood vessels, and either the people are peeing out spike protein, which is my theory based on clinical observation. I just haven't been able to prove it with labs, but that explains some of the people who had kidney pain like a year and a half ago. And then now we're getting people with kidney stones. So a kidney stone, okay, so let's back up. Somebody who's irritating their kidneys with sugar, over time, they're going to get urinary tract infections. And if it continues for many years, they're going to get other kidney related problems, kidney stones, which are part of the pre-diabetic or diabetic pattern, because long-term irritation to the kidneys, it's not what's in the stone. MDs are going to look at what's in the stone and say, don't eat these things. And you're going to end up being told not to eat oxalic acid containing vegetables, as if vegetables got the person there, which is ridiculous. They need to go back to take nutrition courses. Instead, it's something that's irritated the kidney function, and then in the poor state of function, it's mishandling micronutrients such as certain minerals. So now the other problems can be blood pressure issues. Even gout is going to be a kidney problem. These are all related to the kidney. Lower limb edema, right? If the kidneys are really irritated, they can't keep the fluid out from the lower limbs and you'll see swollen ankles. Anyways, these are all parts of that kidney being irritated over time. With the spike protein patients, it's happening within a year and a half. They had severe kidney pain right after they had COVID. Nobody knew why. I knew why, but I'm guessing, but I'm going to treat their kidneys. But a lot of people didn't come to me during that time period or didn't know. Now they're coming to me as new patients. They have kidney stones and we're getting a whole bunch of them. And it's like, okay, did you get kidney pain about a year and a half ago, right after getting COVID? All of them have said yes. All of them. We're even getting a handful of renal failure, kidney failure patients, and their history doesn't make sense based on the presentation doesn't make sense based on their health history. My hunch is that this is another aspect of spike protein damage. And remember, if the spike protein irritated the blood vessels, it's going to make it more sensitive to sugars than it normally is. So now the person's maybe not peeing out spike protein, maybe initially, but now they're peeing out sugars, and prior to spike protein exposure, they weren't. Either way, we got to protect those kidneys. We got to coat the ureter and repair the system while we're decreasing any possible irritants, which could at least be carbohydrates. Not that they're overeating them, but they've just reached a point where they're more sensitive to them than they used to be. Okay, now let's talk about yeast infections. That's totally different. That's from the bottom up, right? So think vaginal health goes downhill, and the vaginal health is related to the gut health. Think of the gut system as an acidic environment. The stomach acid is extremely fierce at a normal pH of 1.2. And if you know pH scales, 7 being neutral, 1.2 is extremely acid. As you go down into the lower GI tract, it comes up a little bit. So it's not as acid, but it stays in an acid pH range so that it can prevent harmful bacteria from growing. So instead, we have our favorable bacteria, which is our microbiome. And that microbiome is going to eat up things that shouldn't be there additionally on top of digestion, and it's going to excrete short chain fatty acids in the process that are very beneficial, that heal the lining of the gut and keep the acid environment in balance. So we have the good bacteria and the good acid. Well, that's the pilot light for the vagina. Really, it's like an extension. In conventional care, they don't think that unless there's some direct, obvious route, but we know the body systems are all related. And so seeing those relationships is really what holistic care is all about. And definitely the female who starts to lose her pH and she's now gassy, and then she starts to get some transient flora down there because the stomach acid actually is neutralizing harmful bacteria, parasites, virus, fungus, anything coming in through the mouth. The stomach acid is so intense, it's going to get rid of that. Think of a dog, they can eat raw chicken because they have more acid. So they're not producing enough acid in the upper GI tract and the stomach. Now they're getting bloaty, they're getting gassy, but they still don't have the bad bacteria forming in the gut. But as that starts to show up, what are they going to get is now instead of gas, it's foul gas. That's the sign you're getting some transient flora that shouldn't be in there. Foul stool, right? And then even now sticky stool where the person has to wipe more. This is signs and symptoms of a transient flora infection of the GI tract. We don't have to run $2,000 stool samples, right? We just talk to the patient. And then, of course, looking at the tongue coating, it starts to get thick. You really don't want to see any obvious coating on the tongue, but that tongue coating is not just sitting on the tongue, it's coming all the way up from the gut onto the tongue. And so we see that signs of infection. Well, now, remember, that's the pilot light for the vaginal health. So without that pH, now the vaginal environment, which is also acidic, starts to lose that pH and get a little bit too alkaline, which means things can grow in there that shouldn't be there. And then the healthy bacteria, normally the vagina is full of healthy bacteria that is eating things and breaking things down that shouldn't be there, and then self-cleaning. It's pushing it to the outside, right? So you'll hear doctors talk to females as if their hygiene is poor. And this is a ridiculous concept. The female body was designed to be naked and not shower and run around the woods and sit on logs and have no problem. And the hardiness of that vaginal immune system is dependent on the gut. So think gut, right? So the gut goes south, and now we're starting to have a change in pH and some weeds in the garden also vaginally. And so now there could be irritation, itch, could be odor, could be a female who feels like she has to shower more frequently. They're a little self-conscious there. And this is the female who is worse with intercourse. And it's not the intercourse at all. It's actually the semen. So semen is rich with minerals, making it alkaline. And if you have a normal acid vagina, which is because the gut is healthy, then it's not a problem. You get some semen in there, and it's kind of the design. But if the person is bloaty and farty and they've lost their acid levels, and so now they have an alkaline vagina and they get some semen in there, it's an irritation. This is the female who feels like she needs to go to the bathroom afterwards and make sure it's out of there because it could irritate. And the real fix is fixing the gut. In fact, actually for that female, to prevent spilling over into a yeast infection, if they felt like one might be coming on, they could actually just do apple cider vinegar orally, not vaginally. We do have vaginal suppository herbs for severe cases, and we rarely like to use those. We rarely. Almost all of our severe cases, even first we fix the gut, and everything is fixed vaginally without touching anything vaginally. So, but nonetheless, in a pinch, you could take 1 to 2 tablespoons of apple cider vinegar, which is a mild acidifier, mixed with water. Take that on an empty stomach, maybe once or twice a day, and that will quickly acidify the GI tract, and that will also change the vaginal environment favorably and maybe prevent impending yeast infection. But the long-term fix is we've got to get rid of the transient flora and really make sure that the gut is healthy. That apple cider vinegar would be really mild. It's not going to really be enough to really turn the whole case around. But in a pinch, it can be a great strategy. But at least you're thinking through the physiology. It's not that everybody needs apple cider vinegar. It would be that the person whose pH is too alkaline in the GI tract would need the acidifier. And then we would just be thinking through, okay, is there an upper GI tract problem that can be fixed as the root cause? Something like that. So having the doctor give rounds of antibiotics, which tears up the gut, only causes more reoccurrence. So always some things to think about. We'll talk about this more. Hope you enjoyed the conversation. All right, bye.